I had done science research for a really long time, but learning how do you see a problem and how do you break it down into component parts and how do you solve it in a week, 4 weeks, 8 weeks? But what was also really transformational was this was the first time I ever saw physicians who were not just at the bedside. They were the
Mm-hmm.
consultants on my team. They were the leaders in the pharma companies and the medical device world or leading health systems. And that was really the moment where I said, I could have a lot of impact on patients at the bedside or in clinic. But what gets me really excited is thinking, how do I make the system better for everyone? And how do I leverage the problem solving and the frameworks a little bit differently? So, with that in mind, I went back. I went to Penn for med school. I trained in internal medicine. And really, since then, and my whole career has been seeking out opportunities to really be working at that system level. I worked for about 6.5 years at a big academic hospital and health system in Boston. And I was a hospitalist a small amount of the time, but I really spent the majority of my time trying to build and design programs and care delivery models that would make it easier for patients to be healthy and for my colleagues to be able to deliver the care that they really, really wanted. And so thinking about readmissions and quality, and I loved that hospital. I loved the mission of it. I loved the impact we were able to have. But people would still fall through the cracks. Like even when we were the doctor's offices and the insurers and the hospital, people were still falling through the cracks. But the thing that I realized was everybody was falling through the cracks with their phones in their hand.
Mm-hmm.
And around 2019, I started looking into the health tech space because having iPhones and having access to people and very light touch ways to engage with patients about their health was really, really intriguing. I joined what was then Grand Rounds and is now Included Health about 6 years ago. And what really got me excited was at that point, they were playing in the healthcare navigation space, thinking about how do we provide financial advocacy and some care management services. But Amy and Owen, um, even at that point, were saying, how are we personalized all in one healthcare? How are we moving into that delivery space? And that really resonated with me. Um, and kind of the rest is history. I've been here for about 6 years. I now lead all of our clinical products and services with a team of about 1,000 employees, all different clinician types: urgent care, primary care, triage, care management. So really excited to be here with you today, Kevin.
Amazing. I was it the the impact of people falling through cracks that led you more towards the leadership than just doubling down on clinical?
hmm I think clinical training and clinical work, first of all, is such a privilege to be
Yeah.
able to be with patients and families at those like critical junctures. Um, but I think as a clinician, it is also so easy in those moments to see how fragile the healthcare system is and
Yeah.
how easy it is for people to fall through the cracks or for important things to get dropped or not connected.
Yeah.
And it was, those experiences that have really, really compelled me to how do I solve those problems, not just for the patient in front of me, but for all of the patients that are interacting at that health system or with our app or things along those lines. And so it was really that framing of I could make enormous impact on the patient in front of me, or I could shape the system in which we are all working and delivering care. And that's what gets me really excited, that potential.